Going back to our segment before on the fear of fillers that has been coming up on social media, we talked about the technology in your injector. I actually have Dr. Madnani here with me, who's in the OR all day seeing a lot of these patients. So the major thing we spoke about was being overdone, using the wrong filler in the wrong plane of the face. And we're going to talk a little bit with Dr. Madnani how fillers are not bad as long as you know which areas you want to focus on. These could be done prior to surgery or after based on Dr. Madnani's consult with you. But once again, we specialize in this. Fillers are not a bad thing depending on which area of the face you want to focus on and what goals you have with surgery or non-surgical options. So Dr. Ram?
So in terms of fillers, I was on that Hulu special recently about patients who had their faces overdone and then they had the filler removed and then resorted to surgical options. If you follow the story clearly, you'll see these patients started with fillers at a very young age. They had a lot of fillers, they were overdone. I guess patients aren't always educated in terms of what's a right aesthetic and what's a good aesthetic and not all providers, I guess, follow a certain type of aesthetic. How do you find a good provider? Well, look at your provider's face, to be honest. Are they overfilled? Do you like the way they look? Look at the provider, look at the people working in the office. Do they have the same aesthetic or natural aesthetic that you're kind of looking for? So in our practice, I'm not seeing a lot of overfill faces at all. We are very strict about that. Steve actually does a lot of teaching for fillers and Botox. So we're very good and clear about keeping results natural. When I do surgeries, I'm not seeing a lot of patients coming in with overfilled faces. However, if patients have a lot of filler in their face, I am dissolving the filler before surgery, or I'm telling patients come in over a year or so after you've been overfilled, and then we can take a look at you and then come up with the best surgical option.